you start with your dominant hand, put that on the chest. Take your second hand, and there's some people who interweave their fingers sort of like this, and there are other people who like to leave their fingers like this. It's sort of a personal preference. Some people kind of get squeezed when you have your fingers like this on the chest. But the most important thing to remember here really is that bad compressions are better than no compressions, as long as you're not grossly hurting the person. So even if the compressions aren't quite as effective as you would want them to be, it's still better than nothing. Okay? And so if you're looking to find exactly where on the chest you want to be, it's right about at the nipple line. And you can actually feel on a person, you can feel on yourself, you know, the top of what connects the two sides of the rib cage in the middle. It's a bone called the sternum. And so you can actually feel the top and bottom of that on the person. And so if you're trying to get a good measurement of where to go, like I said, you can either use the nipple line, or you can try to find the top and bottom of that middle bridging part of the rib cage and find the middle of that and push there. So once I'm in position, what we're going to do is just do non-stop chest compressions. So you want to keep going and continue the chest compressions until either EMS has arrived or there's somebody else to take them over for you. So if you're by yourself, you want to do as much as you possibly can, as many compressions as you can until EMS arrives. If you're in a crowd, again, you find somebody to take over for you when you're tired, because that person's going to be able to give better compressions than you at that point, and you can rotate. And so like I said, we're just going to give non-stop compressions. And the way that this works is there's two important things to remember. One is the rate of compressions. So the general rule is that we want to give compressions at a rate of 100 to 120 beats per minute. And a good way to achieve this for the common person is to think of the song Staying Alive, like the disco song. And you sing that in your head, and if you do the compressions at that rate, that gives you a pretty good between 100 and 120 beats per minute. Okay?
How old are you?
I'm 26 years old.
Did you even know that song when you started this? I didn't know it. I told my kids this, and they said, what? Who? Shocked.
I don't even know.
In the brachial area, because they don't have no neck. And if they don't have a pulse, you just put your arms around them. It's called hand encircling method. With your two thumbs, you just press. A little faster than the adult. A little faster than the adult. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's one complete cycle of 30 compressions without doing breaths. I want you to hear something. When you press, air goes out, air goes in, air goes out, air goes in. So your thumbs are helping the baby breathe and pulse at the same time.
So just the thumbs will keep that.
Just because their heart is, this is how big their heart is.
Let's start again. Do the Texas two-step. Stay on. 3, 2, 1. Do the Texas two-step. Stay alive, stay alive. Stay alive. I'm teaching the millennials. That's right. You guys with it?